Health experts are working to raise awareness about melanoma, a form of skin cancer that can be deadly.
CBS 2's Carolyn Gusoff reports from Nassau County, where she spoke with survivors.
The UV index is rising, and if you're thinking of soaking up the rays, hear from melanoma survivors. There is no such thing as a healthy glow.
My scariest time of my life was fighting this cancer.
A police officer, when she was diagnosed, Sharon Galvin, says nothing was more frightening than melanoma that spread to her lungs.
People would say, oh, well, you only had skin cancer. And I used to laugh to myself and I'd say, well, melanoma is deadly if you don't take care of it.
She joined Nassau County lawmakers in sharing the message about the 5th most common cancer, the most common among people 20 to 39. It's time to break out the highest SPF sunscreen and cover your head outdoors. UV rays can even do harm on cloudy days. And get any mole that's asymmetrical, multicolored, or changed checked. For Donald Gleason, melanoma looked like a red pimple.
You got to be aware of this, because if you're not, it'll spread like wildfire and it'll kill you.
It killed Colette Coyne at age 29 because the diagnosis came too late.
She passed 5.5 months after her diagnosis.
Her mother now spreads life-saving awareness. Her foundation offers cancer screenings at beaches.
We still see people at the beach laying out, you know, really inviting cancer.
Dermatologists say it's a misconception. Melanoma can only impact light skin.
Both Hispanic patients, African-American patients, all across the board. So that's something that often gets diagnosed late, and they have a worse prognosis because of that.
Doctors say even after it's removed, melanoma can return decades later. That's why prevention is key. Check yourself regularly. See a doctor for a full body check every year. On Long Island, Carolyn Gusoff, CBS 2 News.
And the Academy of Dermatology says men over 50 are twice as likely as women to get melanoma.